This week, Ely's hospital has been covered by ash and wrapped in smoke, but it's still providing care. Also, Allina and Sutter make their case for a partnership. Welcome to the July 17th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Maddie McGurran.
Much of Minnesota has been covered by a blanket of smoke this week, approaching poor air quality records in the Twin Cities, Duluth, and other regions. Ely and the Ely Bloomenson Community Hospital have literally been in the thick of the crisis as wildfires have forced evacuations in the BWCA and even approaching Ely city limits. Patty Banks is the CEO at EBCH and says a few staff have had to leave work to prepare to evacuate as the fires rage and ash settles over the town. But she says the hospital's staying open and ready to help anyone who needs it.
It's important in moments like this or times like this that we remain available 24/7, especially through our emergency department.
Banks said that even as fires have approached closer and closer to populated areas, patient volumes have dipped this week.
We are actually seeing a decrease in people coming through our doors because I think with the evacuation notifications that have happened, the people are not coming to the area or are leaving if they have been here.
Hospital representatives are also joining twice daily emergency briefings as officials plan the fire response in the area. But Ely isn't the only healthcare provider that has been responding to the fires. State officials have issued air quality alerts for even healthy people as particulates have drifted south from boundary waters and Canadian wildfires. Dr. Lucan Immel, a Centricare pulmonologist, says people may want to consider wearing N95 respirators if they're outside when the air quality gets as bad as it has been. He urged people to also look for signs of distress among others.
So if you've got a friend or family member, neighbor that you're checking in on, somebody doesn't do well, especially maybe an elderly neighbor or a younger child, confusion is very, very concerning. If you are seeing somebody and they seem like they're more confused with it, they need to seek care in the emergency department. Other things they would be concerned about is just fatigue, difficulty almost speaking, like you're needing to every 3 or 4 words, you're needing to take a deep breath like that.
Dr. Immel said Centricare is also seeing an uptick in people calling into care lines as the smoke has worsened.
And they're needing refills on their inhalers because they're using their inhaler more frequently, or they're needing oral anti-inflammatory medications like prednisone because they're having severe coughing and wheezing. We're seeing a lot of that.
The Minnesota Pollution Control Agency said rain forecasts for today may help slow down some of the fires and clear some of the smoke in the atmosphere. Also this week, executives with Sutter Health and Allina Health made their case publicly for a deal that would join the two organizations. Maddie McGurran has more.
Leaders with both systems spoke at a public forum held by Minnesota Attorney General Keith Ellison, the latest in a series of listening sessions by the AG. Ellison's office is also reviewing a deal between Sioux Falls-based Sanford Health and North Memorial Health with hospitals in Robbinsdale and Maple Grove. Members of SEIU and the Minnesota Nurses Association urged Ellison to put additional requirements on an Allina Sutter merger. They are seeking nurse staffing ratios and a written community benefit agreement. Sutter Health CEO Warner Thomas assured attendees that Allina's 140-year record of community service would continue, expanding its impact in caring for more patients. Sutter hopes to close on the deal this year. It doesn't require approval from the Attorney General, but could face legal challenges from state officials. And in St. Paul, the Minnesota Department of Human Services announced it was extending a freeze on new provider applications for 12 Medicaid-funded programs considered at high risk for fraud. A statement from temporary Commissioner John Connolly said the agency was still working on revalidating more than 5,600 incumbent providers, well after the June 1st deadline that cut off reimbursements for many services. It comes as the state is also gearing up to validate eligibility for tens of thousands of Minnesotans for Medicaid, as work requirements and semi-annual re-enrollments go into effect starting in January.
And finally, here's a story you might have missed. KAAL TV in Austin this week had the story of Sonny's Helping Paws, founded by a Mayo Clinic hematologist. Dr. Nora Benani said a recent study found more than half of doctors reported patients declining recommended care because they were reluctant to leave their pets. She told KAAL TV she'd seen that firsthand in her practice.
And it broke my heart, and I decided that this should not happen. There ought to be a different way.
So Dr. Benani gathered a team of volunteers to provide temporary care to dogs and cats in southeastern Minnesota. The nonprofit she formed links hospital patients with free foster care in homes around Rochester. You can find out more at sunnyshelpingpaws.org. And that's it this week from Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Maddie McCurran.
Thanks for listening.